I think the NHS makes me feel very proud to be British.
Patients are treated on the basis of their need, their clinical need. It's nothing to do with how much they can pay.
I imagine that Mr. Hunt will be all over the celebrations of the 70 years of the NHS, but he really has nothing to celebrate.
I feel like I'm working in what is developing to be an elaborate lie.
It is wrong to be pretending to celebrate the founding principles of the NHS while at the same time making decisions to undermine those principles.
I've been in the NHS for a bit over 20 years now, and yeah, it's the worst that I've ever seen it.
100,000 vacancies, 35,000 nurse vacancies, over 5,000 GP vacancies, and that is unsustainable.
People are just really struggling to keep providing the service that is expected.
You turn up to a night shift and the person before you sits in the handover room and just breaks down and cries.
If things continue the way they are, there will be no NHS in 70 years, and I think that's what the design is meant to be.
We've got a government that has got political and economic interests in breaking up the service and giving it over to private companies to run on a for-profit basis.
Services get worse, not better.
It's an issue of overcrowding and of underfunding, and one can only arrive at the decision that it must be deliberate.
If the NHS keeps people working, it keeps people paying taxes, it keeps people healthy. And that's already been shown to be a positive effect on our economy.
We're all really worried about the future of the NHS, but on the other hand, I also feel optimistic.
It's gone wrong, but it can be righted. We will work to make sure it survives. We won't give up. If you love something, you should fight to defend it.
And if you want to be part of that fight, come along to the demonstration celebration on the 30th of June.